Welcome everyone to this 8th session of the European Climate and Earth Responders course organized by Asst and the Global Consortium on Climate and Earth Education of the Columbia University. I'm the team chair of Planetary Health at the Erasmus School of Earth Policy and Management in Rotterdam, the Netherlands. And today I'm co-hosting this session with Doris Zjalic, a medical resident in public health at Università, Cattolica del Sacro Cuore in Rome, Italy.
Hello.
So we are at the 8th session on climate litigation and health. This is the focus for today's session. The session will explore today the issue of climate litigation with the aim of understanding the state of the art in terms of laws and regulations and key actors that could be involved. It will also increase knowledge and awareness of the opportunities offered by litigation in local, national, and international courts and tribunals, of the crucial role and value of public health professionals in such processes, and the importance of strategic partnership with legal practitioners as part of strategies to tackle the climate emergency mechanisms and tool for strengthening knowledge, skills, and interdisciplinary collaborations in climate litigations and other important issues. So here you can see the learning objective today. It's not just about how is important, but also we will explore environmental harms, legal arguments, and the health impacts, of course, of hit populations, including in children and future generations. And we will also examine previous experiences of climate litigations across EU and the world and how a public health professional could be involved. Some housekeeping rules. 80-minute session with expert lectures, first expert lectures and 2 case study presentations. The sessions will culminate with a question and answer section, so please do not forget to enter your questions for presenters in the Q&A. Sessions will be recorded and posted on the website 24 hours, and reference materials and slide decks will also be included on the website. You will get, as participants, a certificate of participation attending at least 70% of the live sessions, but you will also have to pass the final exam with a score of at least 70% at the end of the course. You have to, of course, join each class session using your personal unique Zoom link and complete the final exam using the email address used to initially register for the course. Your attendance will be automatically recorded during the live Zoom session. The link will be sent on the final day of class via email and will remain open for 48 hours. Then certificate will be awarded on the 16th of April. So without further ado, let's go to today's presenters. We will start with a lecture by Dr. Marlies Hesselman, Assistant Professor at the Department of Transboundary Legal Studies at the University of Groningen in the Netherlands. Then we will have the 2 case studies presented by Barrister Harvey from Greenpeace International Legal Concert Campaigns and by Dr. Bouwer, Assistant Professor in Law School, visiting Senior Fellow at the Grantham Research Institute of the London School of Economics in the United Kingdom. So I pass over to Doris for the introduction of the first lecturer. Thank you.
Hello, everybody. Nice to have you here again. Today, I'm pleased to introduce Dr. Marlies Hesselman. She's an assistant professor in public international law at the Faculty of the Law of the University of Groningen. She has 15 years of experience teaching in the areas of public international law, human rights, and international climate and environmental law, and a strong research profile on human rights and sustainability with a focus on climate, energy, and environmental health. She is also a member of the Groningen Center for Health Law, member of Scientific Advisory Committee for the interdisciplinary Aletta Jacobs School for Public Health of Groningen University, and an active member of the Global Peer Network on Climate Litigation for the Climate Case Chart of the Hesselman Center for Climate Change Law of Columbia Law School. Dr. Hesselman, please, the floor is yours.
Thank you so much for that very kind introduction. Let me start by sharing my screen. And again, saying a big thank you to the organizers of this very exciting course for having me and for allowing me an opportunity to share a bit of my own research in this area of health and climate change law and litigation, but also of my colleagues, because health and climate change is an area that we have been working on for over 7 years within our Groningen Center for Health Law, where we have been looking into different aspects of this question. So, for example, what is the link between international climate law and human rights law, specifically the right to health, but also what is the place of human rights in climate disaster management, and more recently also very much the question of how health-related arguments could be strengthened in climate change litigation, including in particular through, for example, human rights-based arguments, and by also cooperating with public health professionals. Much of my presentation today will be, let me see where my presentation went. Apologies, I think I have the Zoom in view, but not the PowerPoint. Let me see. Yes, this should be able to change it. Great. So today I will be speaking mostly also to a recent publication of the Groningen Center for Health Law and the UK Faculty of Public Health, including written by my colleagues David Patterson and also Farhan Tasib from UK Faculty of Public Health, where we have tried to offer actually guidance to public health professionals on climate change litigation. Right? What is climate change litigation about? Why is it important in advancing health-related arguments, or how could health-related arguments be strengthened and thereby also climate action be strengthened? And today I also hope to bring that message forward and tell you a little bit more about what are these trends of global climate change litigation, both in the global north and in the global south, although of course with a clear focus on Europe today, and how human rights feature in. I also really want to make a strong point of how different health-related arguments are showing up in court. So that means that the public health dimensions of climate change are increasingly considered powerful legal arguments, and not just where they concern physical health impacts of climate change, but also definitely mental health impacts of climate change. And we also see that human rights-based climate litigation in relation to health is often brought forward by specific vulnerable groups that maybe lack a voice in climate decision making more generally, and going to court to ask from their governments, for example, to protect their health better. So that could, for example, include children, but also women, also indigenous peoples. And we see some of these examples as the lecture goes on, both by myself, but I'm also sure by my other two panelists, who will bring also examples of specific cases. I want to end my presentation with a very clear comment on what could be the role of public health professionals in this legal sphere. How could you engage with climate litigation if you are concerned about the health impacts of climate change, but perhaps are not a lawyer yourself, right? So that's the aim for today. So far in this course, you have learned about many different ways in which climate change affects human health. And I like this particular infographic myself. I think it was also shown in the first lecture that you had with Marina Romanello from the Lancet Countdown. And I like this particular infographic about the impacts of climate change on health in particular, because it puts the notion of vulnerability so central. Vulnerability in the sense that certain groups of people or certain countries will be exposed to certain climate events or certain climate impacts more than others. So extreme weather events may strike different countries or different communities in different ways. Different people will also experience issues of heat stress or poor air quality differently. So climate change does not affect everybody around the world equally or in equal speed. So that's the first important issue of vulnerability. But then also there are also a range of personal vulnerability factors that you have learned about, where things like age or biological factors or socioeconomic conditions that belong to people personally or that affect certain communities will also render them more specifically vulnerable to the health impacts of climate change. And from a legal perspective, this is really where policy, law, but specifically also human rights come into play, because human rights and legal responses can help potentially reduce some of these vulnerabilities. Not all, but certainly some. And that includes also increasing protection against specific weather events, for example, in the context of climate change adaptation. So I wanted to start with this picture because you have now this broad idea of how climate change affects health in different ways. And in this lecture, we will look a little bit more into what are the legal responses to reduce these vulnerabilities and how are people also bringing these vulnerabilities to court to demand better actions from their states and occasionally also from companies. If we talk about legal responses to climate change, the Paris Climate Agreement of 2015 is really one of the most important internationally legally binding instruments that help to address climate change. It's a global agreement that was made and is now, all states are party to it, where they agree to take climate action together, stopping dangerous climate change through international cooperation. And what is remarkable of this Paris Agreement is that for the first time, an international climate agreement referred to the importance of human rights in this context. And specifically, states included in this document that in their climate action, they will consider their obligations for human rights, including specifically the right to health. So that means that already in 2015, all states globally supported the idea that climate change is about public health, the right to health, and that the right to health should also be included in this sphere. And I'll come back a bit more in a bit more detail what that means, but it is an important upfront recognition. If we look at what the climate agreement tries to achieve, is this widespread or in-depth global cooperation amongst states to curb dangerous climate change or to prevent dangerous climate change from occurring. And again, a quite unique step in this global agreement was that states came together and said and made a commitment, a legal commitment, to ensure that their actions collectively hold the global temperature increase well below 2 degrees above pre-industrial levels, and preferably even below 1.5 degrees, because they recognize that the 1.5 degree temperature target will be better for more people, will be better for more countries, and will essentially offer better protection against climate change. The question is, and I think this has also been discussed already in some of the previous lectures, including the first one, is the question, what is dangerous climate change? Or what is dangerous to health? In the Paris Agreement, these temperature targets were chosen scientifically, politically, because they were considered to offer a good benchmark, a good chance of keeping the world safe enough. But I think it is fair to say or to ask whether or not even this 1.5 degree target is ambitious enough, especially since we are already seeing serious impacts on people's health today at current levels of warming. So a question could be is, are our human rights, including the right to health, are they already violated in some way now? And if so, what does that mean? Does it mean that states need to take more action or more preventive action? And could people go to court to complain about a lack of protection of health in order to move climate action forward? I'll come back to these comments in a bit more detail. But first, what I wanted to show you is on the right-hand side, an impression of where states are at present. So are states parties to the Paris Agreement taking enough action to really implement this legally binding treaty? How are they approaching this 1.5 target or well below 2 target at the moment. And here it's important to track states' commitments to climate change. So what are they committing in terms of greenhouse gas emissions reductions to be achieved by 2030 or maybe by 2050? And how are they working together? Is global cooperation sufficiently successful so far? And what you see on the right-hand side is the so-called Climate Action Tracker. This is not an official instrument under the Paris Agreement. It is made by a civil society group of people that track what states are pledging to do on climate change. So what do they put in international laws and their policies? What are their aims? But also what are the actual policies and measures put in place to achieve those aims? And there, the Climate Action Tracker at the moment suggests that if we really look at what states are committing in a best case scenario, so all the types of pledges, net zero reductions, so all the things that they are saying that they will do to curb climate change and meet the Paris Agreement, is actually not too bad, apparently, because in an optimistic scenario, the most optimistic scenario, what states are currently committing will bring us within the Paris temperature range of 1.8 degree global warming. However, that's really the most optimistic scenario. If we look a little bit more closely at what states are really committing towards, for example, 2030 targets, so really what are they planning to do also on the short term, we maybe see that in the short term, states are not yet doing enough. So maybe long-term, thinking long-term, it might all work out, but what is really be put on paper for between now and 2030, maybe it is a bit less optimistic. According to the climate tracker, that means potentially we're going towards 2.1 or 2.5 degree targets. And then if we don't just look at what's really put on paper, but also what is being done in practice, the Climate Action Tracker considers that there is cause for concern there because states are not really putting in place yet sufficiently the policies, the measures, the real world action that would be needed to deliver on the targets that they made. So this is where law comes in, because law, to a large extent, provides for both the targets, but also some of the policies and laws that are put in place in terms of implementation. But this is also where litigation comes in, because litigation is currently used very much so to approach states through the courts and say that what you are doing is not enough. The targets that you are setting are not enough to keep us within the Paris Agreement goals of staying well below 2 degrees or preferably 1.5, because maybe your targets are not strong enough, you're not aiming high enough, but also very much so you're not putting in place the policies that you are supposed to. So in that sense, climate litigation is very much about moving this temperature, this climate action tracker forward. But I'll come back to that in a bit more detail. First, I thought this may be helpful to have a quick look at what the human right to health is really about, especially as a legally protected right. We might be a quite diverse group of people in this call, not all lawyers or not all human rights persons. So it's good to know that we all have human rights that are legally protected through international and regional human rights law treaties. In Europe, we, for example, have the European Convention on Human Rights, but also the European Social Charter. And most European countries will also be party to the big international treaties, the UN treaties, such as the Convention on the Rights of the Child or the Women's Rights Convention, but also the Convention on Economic, Social and Cultural Rights. So in that sense, there are a broad range of internationally legally binding treaties that protect our human rights, and some of these will also include the right to health. The most important formulation of the right to health at the moment can be found in Article 12 of the International Covenant on Economic, Social and Cultural Rights. It was already adopted in the 1960s, and that specific legal provision reads that we all have the right to the enjoyment of the highest attainable standard of physical and mental health, and that states are also obliged to take certain steps that are necessary to implement that right. And those steps include, minimally or at least, steps that can prevent reduction of stillbirth, also infant mortality, the healthy development of the child, but also the improvement of environmental and industrial hygiene, prevention, treatment and control of diseases, and also the conditions that would ensure to all access to healthcare, essentially. So we can already see, if we think back about the picture that we had on the first slide, and also things that you've learned in the lecture so far, that many aspects of climate change will be relevant to these different sub-elements of the right to health. And over time, since the 60s, the interpretation of the right to health has also advanced. And we see increasingly also that we are trying to understand better how the right to health is affected by climate change, and what the right to health also obliges states to do in that context. And I'll have an example of that towards the end of the presentation. So, which role for climate change litigation in the sphere? I already referred to this a little bit. Litigation and also climate change litigation is about trying to use existing laws and regulations through court of law to challenge or to change a government's or a company's climate action, specifically often a lack of climate action, so inaction. And the aim would be, for example, to better protect human health, or better protect specifically the human right to health. And we see that the existing laws and regulations that people are using in courts increasingly are human rights based. So rather than maybe trying to enforce directly climate laws, people are going to court with human rights in hand, for example, these international treaties, and they are saying what you are doing is not enough. It's not enough. We are fearing it will affect our human rights, and we will ask the court to intervene. For example, to draft a better target or to draft a better policy. And this type of litigation is being held all over the world and increasingly successfully. So if we look at some of these trends of global climate litigation, we see that this is really occurring all over the world. There are at the moment 2 big databases that you can consult on climate litigation. If you are interested in this, this is the climate case chart of the Salmon Center for Climate Law of Columbia University. They have 2 big databases. One is for the US exclusively, and the other one is a global database. And if we briefly look at the global trend, then we see that at least in 55 countries around the world, there have been climate cases so far, nearly 900 in total. Most of them have been started in the last 10 years and maybe even last 5 years. It's a trend that's very rapidly developing. There is a heavy concentration of these cases in the global north and specifically in Europe. But there are also cases that take place in the global south, which is often considered a region that is maybe a bit overlooked so far, but at least 20 global south countries across Asia, Latin America, and Africa have also seen 1 or more cases. Litigation can take place also at different levels. Normally, litigation will start at a national level because there is an attempt at trying to create some change at national level specifically, but also because sometimes it is a requirement to first try a national court before you can go to, for example, a regional court of human rights or an international court of human rights. So we see that litigation takes place at different levels, and I will give an example of specifically regional or international level cases, but I think that maybe some of my colleagues will also give some other examples. Of these nearly 900 cases so far, a growing number is based on human rights, and at the moment at least 141 cases are somehow rights-based. And among these cases, we have realized that there are actually not too many so far that really specifically invoke the right to health. We found now evidence of 7 to 8 cases that are really directly invoking the concept of right to health. And that's potentially because there could be some limitations on the right to health as a constitutional right in national law, or because people going to court use different types of international treaties that may or may not include the right to health specifically. So in that sense, the right to health is still a right that could be leveraged more, but that doesn't mean that health-related arguments in climate cases do not come in via other human rights, because, for example, also our human right to life or the right to a healthy environment could give rise to health-based claims. So it means that health-related claims could be integrated under different types of rights, not necessarily the right to health only, although of course the right to health would be an important entry point. But that's perhaps helpful to know. Specifically, we also see that in these cases, litigants ask for different things that could improve their health. So an important claim is, of course, that people ask for better climate mitigation action. They are worried about dangerous climate change continuing, so they ask governments to improve their greenhouse gas emissions reductions. We call that mitigation action. But we also see that people are going to court to demand better climate adaptation action. This is where certain impacts of climate change cannot really be stopped anymore. So people might be going to courts, especially in low-lying areas or in small island developing states, whereby they are asking for better protection against climate-related events, for example, because they fear that floods, for example, or cyclones, or soil erosion, water salinification, those things, they may also affect their health. And this is not just then addressed by mitigating greenhouse gases more effectively, but also by putting in place already protective measures on the ground now. Finally, we are starting to see some cases, legal cases, where applicants also formulate calls for more responsive healthcare systems and services. Specifically, for example, the responsiveness of healthcare systems during climate events, or acknowledging that severe weather events might harm the capacity of hospitals to respond in the immediate term, but also in the longer term. There is, for example, a very interesting case in Indonesia where these claims are currently being made. So people are also becoming more aware of the idea that climate change will affect healthcare systems, that in the long run, this will also affect their ability to have good health. Finally, we see also that people invoke health-related arguments in cases that want to stop a specific polluting activity or a specific carbon activity. And I think Richard Harvey from Greenpeace will speak more to these cases in his panel, in his part. And in this case, people go to court, for example, to stop a specific coal-fired electricity plant or an airport extension or a new permit for oil drilling. So rather than talking about climate change in a overarching sense, people are worried about a specific emission activity, for example, and they try to stop that. So it's a more concentrated effort. So with that, it is, and you already noticed from what I've been explaining, it is sometimes helpful to understand that climate change litigations or going to court can have different motivations or objectives. So we are concerned about the impacts of climate change on health in many different ways, but when you go to court, it is important to think what might be the objective. And the objectives there can be different in nature. So first of all, many climate litigations, specifically based on health or human rights, they will be so-called promotive cases, in the sense that they will try to achieve something positive for climate change. So better climate mitigation or adaptation laws, or stopping this coal-fired electricity plant. They want to have a positive outcome. We call these pro-regulatory cases because they want to have a good impact on regulation. At the same time, and this is really problematic, we also see that there is a growing body of defensive cases. We call them anti-regulatory cases, often engaged in by companies, And this involves lawsuits that are essentially trying to stop positive climate action. For example, the regulation of certain companies' activities or the allocation of emissions allowances. And this is done because companies have still major financial or economic interests in their polluting activities. So in that sense, this is an anti-regulatory case, but it may also be in a way an anti-health case because by not curbing these emissions adequately enough, we also do not see the benefits on climate mitigation that we would like to see. But it's good to be aware that there are climate litigations both ways. Some of them are positive, some of them may have negative outcomes. Then finally, it's also interesting to know that some of the climate cases that are being brought at the moment, we might call boundary testing or pioneering cases. And these cases really try to make legal arguments in court, and often as part of also media campaigns and bigger litigation strategies, whereby they are trying to get acknowledged that there are certain specific health effects of climate change, and they try to get more awareness for that. And at the moment, we see quite a few cases where claims of mental health are being pioneered in litigation. I'll come back to this in a bit more detail. But we also see the first cases brought by specific patient groups. So that means that we are seeing cases by people with specific diseases. For example, temperature-sensitive multiple sclerosis, people going to court and saying, if climate change goes unchecked, I will be losing severe quality of life, and not just for me personally, but everybody in the same situation as me. So they are saying that lack of climate action will severely impede the quality of their health and their life. And this is why, based on their right to health, they deserve some type of better protection through mitigation or through adaptation or some other type of assistance. But this requires really a strong argument that climate change does affect the health of these people in a specific way. And it requires a court accepting that and adding consequences to it. So there is a growing literature also trying to understand, together with us at the Groningen Center for Health Law, how health-related arguments could play a role in global climate litigation. There's some literature available on this, not a lot yet. And the literature available at the moment is also relatively old, in the sense that this is a very fast-paced area of study. There's been one major article by Toulen and al. That's the first one on the slides, where they have tried to understand how health-related arguments have played a role in global litigation. So a bit related to the question that we are also asking today. Their sample was until September 2020, which in climate change litigation terms is a long time ago. Because back then they only found 360 global cases. And what they noted in those cases is that health-related arguments were there, but not as much as you would expect yet. And that also these cases are to a large extent so far human rights based. And at that time, there were also not many cases that had been decided yet. So many cases were still pending. So we didn't really know exactly how the health argument would play into the legal argumentation. The second paper here, the role of health in climate litigation, was a similar study about the role of health in climate litigation in the US context. And this is an analysis of US cases, not just human rights cases, because there are not too many human rights cases in the US, but mostly cases where health was invoked in some way. And here, the authors found that invoking a health argument really made a more compelling story, a powerful story, especially in terms of trying to achieve standing, trying to achieve access to the court. Although then maybe the health argument in the actual substantive argumentation of the case was not so clearly there. They also did not find too much evidence in health arguments being a decisive factor in the outcome of the case compared to other cases that were also successful. It was a bit 50-50. For us, this has led to the question in the Groningen Center for Health Law as well, is how could health argumentation be improved or bolstered? Because it is so obvious and so clear that climate change affects human health, but are these human health arguments sufficiently strongly presented in litigation? Are there ways to do so better? Is it possible to strengthen the health evidence, for example, through collaboration with public health professionals? And is it also possible to improve the legal argumentations? So these are some of the questions that we are working on, also in light of the growing body of cases that has come after that, where we do recognize that health is invoked much more clearly. Like I said, both physical health, also mental health, specific diseases, specific groups. So I think there's a lot of things to unpack and to understand there further. This was also recognized recently by the Lancet Countdown on Health and Climate Change, which noted in their 2023 report that law is a very important area for health and climate change, and specifically that litigation is on the rise and an unexplored area, and also the question of how litigation could be used to increase awareness. Because a litigation, a legal case going to court, a lawsuit, is often something that gets a lot of attention in the media, especially when it is well promoted as such by civil society organizations that are involved. So this litigation is not always only just about getting a successful outcome in the case, but it can also really be an important moment for showcasing what is not going well, what type of impacts on health exists, which vulnerable groups are lacking protection or are lacking voice. So it's really also an opportunity to amplify this health and climate change message. And this is something I will come back to a little bit at the end, because this is also where public health professionals have potentially a role to play. If we look at some of the examples of climate litigation in Europe, we see that in 26 countries across Europe, litigation has been taking place so far at the national level, and then sometimes also going up to the international level or the European level. The examples that I have here on my slide are mostly of UN cases, or cases that reached the UN level, or cases that reached the European Court of Human Rights. The first example of 16 children, including Greta Thunberg, going to the Committee on the Rights of the Child, something that I will go into in a bit more detail. The other four cases of Swiss senior ladies taking Switzerland to court, especially at the European Court of Human Rights. Portuguese children complaining about the effects of wildfires, also at the European Court of Human Rights. And climate activists in Norway going to court over plans for oil drilling. There are cases that I think Richard Harvey will talk more about, because also Greenpeace has been involved there. Another case that I also already just mentioned is a case that is pending at the European Court of Human Rights against Austria, where there is this patient with multiple sclerosis complaining that climate change affects their health in different ways. This is not the only health-related claim at the European Court of Human Rights. There are several that are currently pending. But just a few are taken up at the moment by the court for active consideration, potentially to set some initial guidelines or to offer some initial legal guidance, and then maybe other cases will be picked up as well. The cases by the patients at the moment, they are put on hold, potentially because the court first wants to address some of the more general cases brought by bigger groups also of people. But maybe I guess Richard will also say a little bit more about that in a bit more detail. This is a case I really wanted to highlight. It's also a case that we have included in the guides on climate change litigations for public health professionals, because it is a very powerful case from a perspective of health in different ways. So first of all, this is a case that is brought by 16 young people, children, different ages, from all over the world, complaining that climate change affects them and their health specifically in a range of different ways, every applicant in their own unique way. So we have some children from Europe, but also children from small island developing states, from Lagos in Nigeria, from the US, from South Africa. It's a quite diverse group of children. And each of them explained in their own way how their rights to life, right to health, and right to culture were affected by climate change in some way, whereby they cited both physical health impacts, such as increasing exposure to malaria. This was, for example, an argument made by Debbie in Lagos in Nigeria, whereby she said, well, before there was some cases of malaria, but now we see so many floodings in our country. We see that malaria is striking us more often per year. This also leads to hospitalizations. It leads me to miss school, etc., etc. And we also see that most of the applicants made in some way a mental health claim. And there are also issues of fear, depression, eco-anxiety. They are really things that stand out. And where I think there is much more space to understand also what a human rights approach means. Importantly, the children in this case, they relied on broad public health evidence, scientific evidence of climate impacts, different climate impacts on different people in different parts of the world generally, but they also provided very strong personal testimonies of what they experienced in their own lives. And all the health evidence together led the committee to accept that at least at this point in the case, the young people were able to establish that they have personally experienced a real and significant harm from the failure to address climate change, and that also their health, their right to health was affected. The case did not go through because these children had failed to first go through their national court systems, which is a requirement in human rights law. So they actually probably knew that before they started the case, they would not be successful in terms of seeing the case through fully, because it would be denied on the procedural ground. But even regardless, they took this case and really present a strong argument of health and climate change that was picked up in many different news outlets, and also led the Committee on Children's Rights to make some important legal human rights-based statements about how climate change does affect health and could lead to these types of litigation. And also it clarified obligations of states in some way, including responsibility to curb climate change for people that are in a different country. So there are extraterritorial obligations to protect climate change. Having in mind now this let's say this broader area of climate change litigation, let me also quickly speak to the issue of how could public health professionals get involved in health-based litigation. Like litigation and law, it may sound sometimes a bit scary or far away, something that is difficult to understand. But we also at the same time see public health professionals getting increasingly active in climate activism, health-based climate activism, going to the streets, speaking out. And I think what we want to put forward is that engaging in litigation is another way of speaking out, sharing your expertise and amplifying a message. So one easy way for public health professionals to get involved in litigation, for example, going on in your country, is to try to amplify the public health messages that stem from that case, for example, by engaging on social media. So really showing how this litigation is about public health, improving it, and what it is that victims are claiming and experiencing. So it's about social activism through litigation. If you want to get more involved, an option would be to actually seek cooperation or reach out to climate lawyers active in your countries or environmental NGOs active in your countries, and trying to see what type of health arguments or health-related climate cases they might be working on and what type of support could be given in that respect. More specifically, public health professionals, they have different tools available in terms of collecting evidence and making that evidence also known. And there we, for example, could think of carrying out relevant desk reviews of evidence available, literature studies, but also documenting and reporting specific cases. This is also where people deal with specific cases in their practices. There's a good practice of health and vulnerability impact assessment. How does climate change feature in there? Epidemiological studies are vital tools for charting how climate change may be impacting certain public health issues specifically, but also at a smaller level or more local level. Is there space for qualitative research, lived experience research? How is it that people are coping with climate change in their daily lives? And is this, for example, where issues of mental health also come more to the fore, become more tangible? And this is actually then also where public health professionals could play an instrumental role in improving the health-based arguments in climate litigation, which is by developing compelling health narratives in the litigation, convincing health narratives. What is it that makes this a case about health? What is the evidence available? And how could the health evidence be understood in a court of law? If necessary, that could include providing expert testimony, but it could also mean working together with a legal team to try to understand what is actually going on here and how could it be presented in a court in a compelling and convincing way. If this is something that you are interested in, I definitely recommend to read the guide in a bit more detail, because there's a lot of inspiration for how it's possible to get involved, but also how to build competencies and how to access further resources in this area. As a final comment, I want to say we acknowledge that there is a risk, specifically also for public health professionals, to get involved in climate activism. We see, especially in Europe, that the space sometimes seems to be shrinking. It's more dangerous for people to speak out and to engage in activism. Just in the UK, we've seen concerns that doctors that are engaging in climate protest may risk being fired from their jobs. And there are cases pending on that at the moment. And the UK Health and Climate Alliance has said that please try to be as lenient as possible with doctors that are essentially just speaking out in favor of the public good, in favor of health. And I think in this specific case, it's very interesting to also really ask, what is the duty of the public health profession in speaking out against a crisis that is so big and that we know will affect health in so many ways? What is also a public ethical professional responsibility? But again, recognizing that from a legal perspective, there may also be repercussions. This is a fight that is being fought all over Europe. And we also see, for example, in the Netherlands recently, that climate activists were taking to court for taking some actions. But our courts have recently ruled that the right to protest is a very sacred and protected right. And specifically in this context of climate change, people should be able to speak out. The benefit potentially of engaging in specifically support for litigation and also strategic litigation is that it does not necessarily require people to go to the streets, but to tap into an existing case that is ongoing in the ways that I have described, building really on unique expertise and trying to support not just this specific case, but also supporting what that specific case stands for. A litigation can really be about generating wider impact beyond the court case by trying to communicate what this case stands for in terms of bigger systematic issues. What are the types of gaps in health protection that really should be closed, or which type of knowledge do we not really have that should be attained? But also, how can we build a new narrative together that climate change is about human rights, that it is about the right to health, that it is about public health, and how could cases also be used to better educate the public about the public health effects of climate change. So tapping into these litigation procedures can really offer up a lot of opportunities to become more active in this sphere without necessarily going to the streets, if that is something that people find sensitive to do, specifically in specific professions. So I hope with that I gave a good introduction to the people in this group, which again I realize maybe from different backgrounds about what is going on with health-related climate change litigation in Europe, but also specifically how we might be able to improve it. Again, acknowledging the fact that climate change affects health in so many ways, and in ways that deserve to be much better understood also by a wider public. Thank you.
Thank you very much, Marlies, for this very interesting presentation. Now we have time for question and answers. So I will start with the first question. That's about the Paris Agreement that you mentioned at the beginning. The question is Paris Agreement legally binding? And are the targets voluntarily determined if it is not? You are muted.
Yes,
sorry.
excellent question. Excellent question. Yes, so the Paris Agreement is a legally binding treaty. When states ratify it, they commit to achieving what is set in that document. The challenge with the Paris Climate Change Agreement is that not all of its provisions are formulated in a very legally clear way, which can occasionally affect the legally bindingness, at least in the sense that I have to do something, but it is not so clear what I have to do. One thing that is very clear, and it is a very clear legal obligation under the Paris Agreement, is that all states have the obligation to make a commitment. So all states must make a nationally determined contribution to tackle the issue of climate change together. Now, initially, when the Paris Agreement was adopted, there were great worries about the fact that countries would be allowed to individually decide what is their own contribution, right? Subject to some limitations, because the Paris Agreement also says that any national contribution must be ambitious, must be a best effort. Developing countries must take the lead, and the commitments must also be progressive over time. So it's not entirely discretionary, but there was concern that at least there was some room to decide themselves. My personal take on this is that that fear perhaps did not turn out to be so true, because yes, we are seeing that states were maybe a bit reluctant to commit, especially also in the global north, to commit sufficiently ambitiously. But precisely because there is this option of increasing the ambition over time, I think this flexibility has now led to the fact that climate change litigation and people going to court nationally against their own government saying, I think what you're saying to the Paris Climate Change Agreement and in your nationally determined contribution is not ambitious enough. We know you can do better, you should do better. So I think actually that the mechanism of allowing states to voluntarily commit to their targets, combined with human rights law and combined with national societies being critical of their states, of what they're doing, is leading now to a positive situation whereby we're seeing that actually the targets that are being put on paper are getting us toward the Paris Agreement temperature goals. So I think that the model that was opted for in the Paris Agreement of having a legally binding agreement with some flexibility for states to decide their own national levels has led now to a positive outcome whereby people are asking states to be more ambitious. Right? Not everywhere yet, and it can still be more ambitious. But I hope that answers the question. Yeah.
Thank you. Another question is, when it comes to carbon-intensive companies, is litigation more effective than green shareholding, such as Follow This? What is the evidence on that? When is one better than the other?
Yeah. That's a very good question. I think, first off, in this climate sphere, all strategies are welcome. So I would say it's not an either or. Activists should definitely try to force companies to be more progressive, more ambitious in different ways. In terms of what is more effective, I am not entirely sure. I haven't studied data on that. I'm not sure if there's data available on the effectiveness of whether or not green shareholderism or climate litigation is more effective. What we do see is that certainly in the Netherlands, climate change litigation against companies has been effective. We have had a very powerful case against Shell, whereby an environmental NGO actually went to court and successfully forced, also based again on human rights arguments, Shell to go faster. This was such a strong precedent that based on that case, the NGO Milieudefensie has said to, I think, up to 30 other companies incorporated in the Netherlands, saying, see, we now have this verdict. If you don't do better, we will also sue you. We expect you to deliver a more ambitious climate action plan and show us what you're doing differently, so we won't sue you. And now, I think in January, Milieudefensie has taken the step of suing at least one more bank to also to strengthen their climate targets. So we see that litigation against corporations can be successful, but we've also seen some examples of where it might not always work out. And in that sense, we have to acknowledge that litigation is occasionally successful, but occasionally also unsuccessful. And that depends to some extent on the legal systems in which the litigation takes place. May also depend on the evidence that is able to be brought or the type of claim. So it's difficult to answer in the abstract, but I think both strategies are definitely needed. Yeah.
Yes, thank you. Unfortunately, for instance, in Italy, there was a recent climate litigation that was positively didn't have positive outcomes, unfortunately. Okay, let's move to another question. Do you think carbon trading between states is a good idea or just window dressing about lack of action?
Yes, that's a good question. Carbon trading. So for those who might not know exactly what carbon trading is, it's the idea that was included, not included, but supported by the original international climate change framework, whereby it would be possible to trade in carbon emissions, whereby you might say, okay, we have done very well. We have reduced carbon more than we expected to, and maybe we can sell our carbon to somewhere else, or another company saying, we are not able to meet our targets this year. Can we maybe buy some credits from you? So the idea behind carbon trading initially was that it doesn't matter where we reduce greenhouse gas emissions, as long as we do it somewhere. So the idea is that maybe you reduce more in one place, but less in the other, but overall it balances out. For me, this suggests a very economic way of thinking about climate change. I think it suggests a way of thinking about climate change that fits in very well with the neoliberal thinking in the 1990s, when the first climate agreement, the UNFCCC, was drawn up, whereby these economic solutions were maybe logical at the time. They fitted in with the thinking. It was something that was attractive. It does make some economic sense. But there are many problems known with carbon trading systems in terms of how they are designed. And for me, it is also a matter at this point in time of saying, this is not just an economic problem. It is a social problem. It requires states and also companies just to make some very rigorous decisions. It's not, in my view, something that can be solved through just mere economic thinking or economics. This is something that is a very principled matter, and it just requires companies to make a commitment regardless of what are the economic possibilities, if that makes sense. And it's of course a difficult ask, because companies are economic beings, economic animals, but we are at a point where the climate crisis, it cannot be solved anymore by just economic thinking. That's my position on it, and I think this is also where a human rights argument comes in, by making clear that this is very much this societal, social issue. Yeah.
Thank you, Marlies. I think that is a very, very important message to conclude your intervention. So thank you again. And now we start the part related to case studies. So please, Doris, it's up to you for the introduction.
Thank you for this insightful lecture, Marlies. The time is running, and let's go on with the case studies. It is with great pleasure that I introduce the first presenter, Barrister Harvey. He is the legal counsel for campaigns at Greenpeace International. He focuses on climate-related strategic litigation, promoting the human right to a clean, healthy, and sustainable environment. He works in particular on adverse impacts on people of the global south caused by global north, corporations, and governments. Most recently, he appeared on behalf of Greenpeace in Klima Signorini and Schweiz before the Grand Chamber of the European Court of Human Rights. He's a barrister and a member of Garden Court Chamber London. He served as an attorney at the New York and was the lead counsel at the International Criminal Tribunal for the former Yugoslavia. Please, Richard, the floor is yours.
Thank you very much, and special thanks to Marlies for her excellent summary and introduction. If we could put my slides on the viewer for everybody, that would be great. I particularly want to thank Asst and Columbia for bringing almost 1,000 people together for this seminar today. And I would like to start out with looking at the human right to a clean, healthy, and sustainable environment. Is somebody sharing, putting my, there we go. Ah, thank you. Yeah. So if we could move then swiftly to the second slide, this is, as you can see, that states tend to take the position right now that human rights really only started in 2015 when the Paris Declaration was signed and became legally binding as an international treaty the following year, 2016. Whereas, of course, human rights go all the way back to at least the Universal Declaration of Human Rights in 1948, but there has been an acceleration over the last few years of focus on climate change and its interrelationship with human rights, starting with the wonderful Ogender versus Netherlands District Court ruling in 2015, and moving on with exponential speed since then. In 2018, the UN Special Rapporteur, David Boyd, asked the UN General Assembly to recognize a human right to a clean, healthy, and sustainable environment. And the key there is healthy. I'm not a health specialist, I'm not a physician, I'm just a humble lawyer. But I think this has been an extraordinarily important development because it's led in 2021 to the UN Human Rights Council recognizing the human right to a clean, healthy, and sustainable environment. In 2022, the UN General Assembly passed a resolution on the same. And in 2023, as we will see, the International Tribunal on the Law of the Sea, the Inter-American Court on Human Rights, the European Court of Human Rights, and the International Court of Justice have all been called on to give their opinions on how this right to a clean, healthy, and sustainable environment should be pursued. Next slide, please. And as Marlies just mentioned, I was in the European Court almost exactly a year ago, 29th of March 2023, for the hearing of the case brought by the Klima Signorinnen of Switzerland. And one of the things I want to underscore here today is that the right to life means a right to life with dignity. And what does that mean? The Swiss Climate Seniors were founded in 2016 by a few hundred Swiss women pensioners. Their numbers have now grown to over 3,400. And they battled through the Swiss courts where the judges ignored scientific proofs that premature deaths were being caused by extreme heat waves. Their Supreme Court ruled that, the planet hasn't yet reached 2 degrees of global warming, so leave this to the politicians. We all know how successful that has been as a strategy. The politicians themselves blamed the electorate for failing to pass a climate change referendum. The fact that that referendum was all about asking the wrong questions and asking insufficient questions was something that they overlooked. So the Klimaseniorinnen applied to the European Court of Human Rights, and that court fast-tracked their case to the Grand Chamber. We told the Grand Chamber last March that the right to life means the entitlement of individuals to be free from acts that cause their premature death, as well as the right to enjoy a life with dignity. The world has never seen a threat to human rights of the scope presented by climate change. This isn't a situation where any country, any institution, any policymaker can stand on the sidelines. The economies of all nations, the institutional, political, social, and cultural fabric of every state, and the rights of all people, including future generations, must be understood as having been impacted. There's only one way to prevent the 1.5 degree limit from being breached, and that is for global emissions not to exceed what is called the carbon budget. That budget must be shared fairly between states. Switzerland has failed to make their own carbon budget 1.5 compatible. This means, as we say, they're going to use up the share of other states. We call that carbon theft. And we finalized our statement to the court saying in these words, if a state as rich and technically advanced as Switzerland does not do its fair share, taking the lead as well as pursuing its highest possible ambition, then other states will say, why should we? They simply won't bother to do so. And just yesterday, we received the letter from the court notifying us that we are going to get the decision in the Klimaseniorinnen's case 2 weeks from today. And so that's not just the Klimaseniorinnen, it's also the Portuguese youth who are alleging that their lives, their quality of life is being undermined because of their extreme fears for the future. It's being challenged by the Norwegian youth who are saying, at this point, with those of us in our teens and young 20s who might be thinking about having families are really having to question whether it is wise to bring more children into the world. And if there isn't a bigger threat to the right to life than the right to bring life into the world, I'm not quite sure what is. So this decision on the 9th of April will affect not just the European Union, not just Switzerland and Portugal, but all 46 as they now are, members of the Council of Europe, and it will have a global impact. Switzerland's 5 hottest summers occurred between 2003 and 2022, with a rise in heat-related deaths, especially in older women. Science tells us that older women are more vulnerable to heat-related illnesses and death, as their bodies are less able to regulate their temperatures due to impaired thermoregulation. They experienced unprecedented summer temperatures of 34 to 40 degrees Celsius, exacerbating existing health conditions and both physical and psychological. Dignity? Should we talk about dignity? One 76-year-old Clima Senora tells of the impact of the summer heat wave in 2022 on her dignity when she took a train journey to the mountains in search of cool air. I quote, "I sweat, pant like a dog. I can hardly breathe. I'm close to a panic when the doors close. I can hardly breathe. Please, cool air, where are you? What is happening with me? Why do I sweat so much? The sweat sticks to my face, back, t-shirt, panties, bra. Everything will be soaked before long. It feels even hotter here. Am I going to keel over? It's ringing in my ears. What is happening to me? I urinate in my hiking pants. That is enough to make one cry. Degradingly embarrassing." It's vital that we bring the words of the people to the court so that judges understand what it feels like to be trapped in situations like that. We can have the next slide, please. I know that most of you are probably aware that anything between 60 and 80% of the world's population today rely not on the pharmaceutical industry, but on herbal medicines for their primary healthcare needs. Just let that sink in. 60 to 80% of the world's population rely on herbal medicines. Now, the British Medical Journal last year cited global studies that up to the year of 2019 showing all excess deaths due to fine particulate and ozone air pollution are estimated at 8.34 million deaths per year. A 2019 estimate had excess deaths per year globally at 5.13 million. So the figures may vary. What is extraordinary and frankly terrifying is the number of clearly avoidable deaths, premature deaths being brought about by air quality changes alone. If you do the sums, and I'm not a mathematician, check my working, but it seems to me from the evidence that I have seen that more than 500 million premature deaths will occur by 2100, by the end of this century, unless climate change is tackled seriously. These numbers are not just about deaths, but they're about the appalling individual suffering that is inflicted on all of those who are dying slowly, more often than quickly, as a result of poor air quality, the diseases that they suffer from. So it concerns the quality of life of impacts on the entire social system. This speaks to judicial and scientific truth, speaking to political power. A street vendor, you can see on the right side what it's like to live in the most polluted place on earth. A street vendor near the Sacro plant in South Africa, just 30 miles from Johannesburg, where 1.7 million people are living in the shadow of the most dangerous pollution on earth. The local power plant you see in the bottom right picture, with children playing outside their home, a shack in the shadow of Lethabo coal-fired power plant. Lethabo means happiness. It's belching out ash and toxic sulfur dioxide, and children are playing in the shadow of the world's largest greenhouse gas point source emitter. The wind that carries those fumes into the township brings health impacts with them, including chronic asthma and premature death. These industries make people ill, but at the same time, they're virtually the only source of local employment, given that 1 in 3 South Africans are unemployed. So we in Greenpeace are helping to bring these voices to the International Court of Justice, which I'll come to in just a moment. One of the voices, a woman by the name of Chepiso Matsweni, says, our hospitals sometimes run out of equipment. So if you can't afford to go to a private hospital, then you're doomed. Now you find a lot of plants that don't grow anymore. Our ancestors were able to go in the garden and get the herbs in case a child or an elder was sick, but that no longer happens. Traditional healers are no longer able to get their traditional healing plants from the surrounding area. I want to take a quick moment, if I may, with 9-year-old Ella Adu Kissi Deborah, who died from asthma due in part to air pollution around her home in London in the UK. In 2021, sorry. Yes, please.
Mr. Harvey, sorry, you have 1 minute left because we have to present also the last case study. I'm sorry.
Yeah, this I'm sorry too, because there is so much more information I would love to be able to share with you. Well, I just want to focus then in that case. I'm sorry, Ella, in your memory, we will continue to struggle. We are in the human rights place at the human rights time. Slide, two more slides ahead, please. That's in 2018, a group of Pacific Island law students formed Pacific Island Students Fighting Climate Change with the aim of taking the world's biggest problem to the world's highest court. Their call was taken up by Vanuatu and other Pacific Island states, and it's caught fire. In less than 5 years, they've made it. As we walked out from the hearing in Strasbourg last March, we were confronted with the news that the UN General Assembly has asked the International Court of Justice to provide an advisory opinion on what states' responsibilities are under international law to ensure the protection of the climate system for present and future generations. I'll stop there very sadly and hand over to...
Thank you very much for listening to me. And as I say, please do go back through the slides and read those statements in more detail. And sorry, I think I've run 2 minutes over.
Thank you very much, Kim. Unfortunately, we are out of time, so I'm sharing the last slide for you to remind that there is a post-session survey. You can scan with the phone camera this QR code, or you can go to the link in the chat. So please do not forget to fill in our post-session evaluation. Thank you very much to all the lecturers, and see you to the next session on next Tuesday. Thank you.